The emergencies are limited. So you don't have to, unlike a trauma surgeon or orthopedician, you need where you have to operate at the middle of the night, or neurosurgeon where you have to see critical patients immediately. Now ophthalmology is into super specialization. There is cataract, there is refractive surgery, then there is glaucoma, then cornea, which is becoming a big specialty now. As a core private practice, that alone will not suffice. You need to develop certain avenues for revenues. So you have to establish pharmacy, labs, the opticals, the diagnostic areas, and also managing private operation theatre facilities. It's really, in ophthalmology, is very, very critical.
So even to set up a clinic, even the amount you said, 1 crore, is it for a small nursing home or for a small clinic setup?
No.
In this current scenario, can you give your comment about the current job prospectus for the coming ophthalmologist and the future scope?
There are 3 or 4 areas where you have opportunities abroad. So one is the basic research, ophthalmic research. So this position is open across Europe and US. So what is your orientation? Whether your interest into the academics, your interest into entrepreneurship, or your primary interest is only getting money.
Everyone would have understood that you had been the excellent teacher and now you are a very successful practitioner. So now I would like to ask you a few things regarding how the students who finish their MBBS, in case if they have a dilemma whether to select ophthalmology or not. So can you please say a few words, elaborate a little bit about the current scenario of ophthalmology practice and the field and the future scope, and what they have to see before selecting this field, etc.
Okay, so now that every MBBS student who comes out of the college want to go for specialization. Okay, so you have to decide what type of work you are going to do and what is your interest. See, some of them may not be interested in surgical field, some of them will be oriented towards medical field. So you have to audit yourself, your interests, and then self-interest, and what is the scope for that specialty. So that is also important, because as I've seen in the last 30 years, so primarily the broad specialties had a bigger role, like pediatrics, OG, and orthopedics. All those things were specialties by itself. But now it's a time for super specialization. So every subspecialties, there are 5 to 6 super specializations. And previously you can try your hands in anything. So but now it is not like that. So MBBS has become the base, and from then onwards, it is not only the degree that gives you the scope for your career growth, but also your interest. Okay, so if you have a good academic background, you can choose whether go for an academic career or not. And if you are an entrepreneur and you have interest in entrepreneurship, you have to orient yourself to private practice, right? Or you can do you don't have this administrative capacity or entrepreneurship potential. You have to work in an institution. You have to select your field accordingly. So primarily either medical field or surgical field, or there are now a lot of scope for technology based thing. So telemedicine has come in a big way. So you can be an entrepreneur in that, or you can even work in that field. Then artificial intelligence and robotic surgery, then genetics. When we started, there was no such field as genetics. Now genetics and genomics are important things.
Yes, yes, yeah.
Then biostatistics, you don't know, in right, epidemiology is a big specialty now, and post-COVID it is gaining a lot of importance. So every decade there is a change in the way medicine is perceived. So primarily medicine or surgery or any other interest you have. Then if you are going to select a surgical field, see whether you have passion for doing surgery. The long hours of standing, long hours of work in the surgical field, and then the skill for the surgery. Suppose you want to become an ophthalmologist, definitely you should have finer skills. The hand-eye coordination and motor skills using all the four limbs. So some people who have ambidextrous, using both the upper limbs, they shine very well in ophthalmology. Okay, so these are some things you have to analyze yourself. So first you have to do a SWOT analysis. So I would suggest to all people who have taken medicine to do a SWOT analysis yourself. Write it down. So what is your strength? What is your weakness? So what are the opportunities in the field you are interested in? Right, so in ophthalmology there is a lot of opportunities now, which were not there when we selected ophthalmology. And of course there is a threat, right? So automation. So when automation comes into the field, automatically there will be job loss. Okay, so even though the specialty will change, but definitely there will be a job loss. Okay, artificial intelligence, if it comes into medicine, the diagnostic fields can get affected. So you don't need a human behind doing the test. Okay, so all you need is a person who can interpret. So even robots can do that. Artificial intelligence can do that in a much better way. Okay, so you have to think of what are the advances. So doing a SWOT analysis, strength, weakness, opportunities and threat before selecting any specialty is important. So strength, SWOT analysis by personal nature. So you have to critically analyze yourself. So what is your orientation? Whether your interest into the academics, your interest into entrepreneurship, or your primary interest is only getting money, right? So business skills. Then you have to diversify yourself into areas where there will be a lot of scope for getting money. So there are people who are passionate at research and publications. For them, pushing them into a private practice will be difficult. Okay, so you have to, so first thing, do a strength, weakness, opportunities analysis as a person. Then for the specialties you are going to select, and then for the specialty itself. So you have to do a SWOT analysis for the specialty at this point of time. So coming to ophthalmology, strength it is a wonderful field for people who are interested in surgery. And for ladies, again, it is a good because the emergencies are limited. So you don't have to, unlike a trauma surgeon or orthopedician, you need where you have to operate at the middle of the night, or neurosurgeon where you have to see critical patients immediately. In ophthalmology, not so much critical surgery, so you have to be choosy. So if you are a family-oriented person and you want to have fixed timing for your practice, then ophthalmology is good. And third is the changes. So ophthalmology, as I have seen over the last 3 decades, so previously it was a simple setup. Then a lot of diagnostics came into the picture. Right, and this diagnostic were quite costly. So if you want to set up a private practice in ophthalmology, you have to have at least 1 crore investment. This may not be viable for everybody. So then you have to work with the institution or join some people and do group practice. And also now a lot of super specialization has come into ophthalmology. So it's not ophthalmology as a surgical field. Now ophthalmology is into super specialization. There is cataract, there is refractive surgery, then there is glaucoma, then cornea, which is becoming a big specialty now. then vitreoretinal specialty, then oculoplastics. Okay, so now the UVA is developing into a specialty. So all this subspecialization and super specialization has come in the last 10 years.
Is it available in India also, sir?
Yes.
Yeah. Okay.
So there are fellowship courses available for super specialization. There are recognized courses available. So for example, National Board has VR surgery as a fellowship. Super specialization. Same way, pediatric ophthalmology and strabismus is a super specialization. And most of the other fellowship are given by institutions, right? So there are in India a lot of ophthalmic institutions, right from Shankar Nethralaya. South India has the most number of ophthalmic institutions. Arvind, LV Prasad, Shankar Nethralaya, Shankara Eye Hospitals, then Narayan Nethralaya. All these are big names. So they focus on as a teaching institution as well as doing real work in the super specialities. Yes, they were pioneers. So obviously they have a head start, and they have established the fellowship norms as well as the departments for that. So they have helped the specialty grow in all directions. So super specialization has a big role. So if you want to again set up into private practice, as a private practitioner in VR, it is going to be really costly. So establishing a vitreoretinal clinic will take at least 1 or 2 crores. So you have to see where your strength is. If you have the financial background, definitely yes, or you have to join with people. Okay, so that's the way you have to decide whether to come into the ophthalmology field or not. So one, your interests, your attitude, and your family background, and then time you need, your personality as such, time you need for the family, for yourself, and
physical factors.
Yes. So this is, if you want to have a good practice, you have to put a lot of time and effort. So, as I said earlier, I used to work for 18 hours.
Yes, sir.
Now it has, of course, come down based on the priorities, but it is long hours. Okay, so we have to spend a lot of time with patients if you want to develop your practice, and also develop other interests if you want to run a private practice. So this core skill alone will not help. So you have to develop man management, soft skills, particularly communication and counseling, and then accounting skills, and also entrepreneurship skill. Because as a core private practice, that alone will not suffice. You need to develop certain avenues for revenues. So you have to establish pharmacy, labs, the opticals, the diagnostic areas, and also managing private operation theatre facilities. It's really, in ophthalmology, is very, very critical. So you have to learn about infection, sterilization, and also certain things about the biomedical aspects, because we use a lot of equipments. So unless you know some basics of biomedical equipment, very difficult to manage them. So you'll be spending a lot on maintenance. So these are some of the key areas when you want to come to ophthalmology. You have to have this in mind.
Yes. Can you mention? Can you say anything? Any challenges in this, in the particular to the ophthalmology field?
The challenges are there because from primarily being less resource needed specialty. So 30 years back, all you need is a basic clinic, one refraction set, one slit lamp, okay, and few torchlights, and one ophthalmoscope. Now it's not like that. So the advent of the equipments, this has changed. So the diagnostic equipments, now you need a fundus camera, you need a OCT machine, then field testing machine, then you need a B-scan, then diagnostic topography, then the biometers. So all these are minimum cost is 20 to 25 lakhs.
So even to set up a clinic, you even the amount you said 1 crore, is it for a small nursing home, or for a small clinic setup?
No, even for a clinic setup, you need these basic steps. So now some of the equipment have become basic.
Yeah.
Like, so if you are going to do cataract surgery, you need a biometer because the expectations have increased.
Yes, sir.
So even though you can manage with a ultrasound machine, but over a period of time, you want to scale up. Then you have to invest on this.
Yes, sir.
Okay, so the more premium practice you want to establish, the more you have to invest on this equipment because you have to give premium results. So in a city setup where there's so much competition, unless you scale up your practice in terms of facilities, in terms of diagnostic equipment, in terms of the scope of service you offer, you can't just rely on refraction and cataract surgery. So you have to give a bouquet of services. So you have to be good at glaucoma diagnosis and therapy. You have to diagnose retina conditions. You have to, now oculoplasty again is not just oculoplasty, now it is also aesthetic surgery. So a lot of people who are very conscious about this eye bags, Prof, all those things. So youngsters, so you have to give them good care about their aesthetics also. And same way, people want instant results. So previously we used to admit patients for 1 week for a cataract surgery. Now the incision has come down from 12 millimeter, it became 6 millimeter, 3 millimeter, now it is 1.2. Now we perform micro incision cataract surgery with 1.8 millimeter, which means the stay also come down from 1 week, it is 5 days, 2 days. Now it's just walk in and walk out. So today I have 5-6 patients. All of them will be coming around 2 o'clock. So after the interview, I'll go and operate. By 4:35, they'll be discharged. And they'll be seeing. So they'll just go with the protective glass. So this kind of advancement and this kind of advanced surgery, if you want to give, you need to have the best of equipment. So that takes good amount of investment, maintenance of the equipment, and you also have to keep on upgrading your skills. So when I started, it was intracapsular cryo, which means you have to pull out the full lens, leave them FA and give them big glasses.
Yes.
Okay, so many of your grandparents would have gone through that. But now it is all foregone era. I can't do the same thing now. Then came extracapsular extraction, sutures, because that improved the healing in a better way. And then intraocular lens. So intraocular lens came into the picture the last 20 years back. So we learned that, putting an intraocular lens. And then sutureless surgery, small incision, cataract surgeries. So self-healing incisions. So we have to master that. Okay, with that is 6 millimeter.
You have to keep update yourself.
Yes, you have to upgrade yourself. You have to learn new things. So if you resist, you will be washed away.
I think it's a very fast developing field.
Yes, definitely. The last 30 years, we have seen big strides in ophthalmology, not only in technical knowledge, in scientific knowledge, equipmentation, as well as the type of surgeries. So now cataract surgery or any surgery, it is sutureless and closed valve surgery. So we are not worried about infection or any other things anymore because all these are very, very small. Even vitreoretinal surgeries is 26 gauge. So now it is becoming 30 gauge vitrectomy. So 30 gauge, imagine that's the incision. It's like giving an injection. Right? So surgeries have come fine-tuned to that. So obviously this needs instrumentation. Obviously it's more research.
It needs very high level of skills.
Yes, definitely. The skills have not the rough skills. It is also improvised. Right? So you need to have perfect hand-eye coordination. You have to use all your limbs, and you have to see the changes. So changes will keep happening, and you also have to learn, right? And a lot of unlearning needed. So you can't use the same technique you did 20 years back and try to learn a new technique. So you have to unlearn a lot, give up that skill, relearn, and also as per the usage of equipment. You have to use a lot of equipments, learn to use those equipment to the thing. So at the end of the day, the skill of the surgeons and the passion about the surgery, so this counts more than the equipmentation. Even with the raw equipments, you can do a good surgery. So with advanced equipment, the fairness and the outcomes improve. So at the end of the day, it's not about what you are as a person. You have to use the process. You need to have good, rigid processes to give good outcomes. So you also need a good design, basic setup, wonderful theatre, trained manpower, and also good and advanced instruments. So this will take care of the outcomes. And of course, you have to audit yourself, audit your work, what are the results you give to the people, the outcomes, and also get their satisfaction. So at the end of the day, if the patients are not satisfied with your service, so even though you are a skillful surgeon, that doesn't matter. Even though you have a big name, that doesn't matter. For the patient, the way they see their outcomes. So without glasses, if they are able to read something. So today morning I got a patient, a doctor, so who had the old IOL in the one eye. But this time we implanted a trifocal lens. And he is able to read without glasses. For him, that is a luxury. Okay, it's like regaining their vision lost at 40 years, presbyopic age. So if he is able to read without glasses, so that is the best outcome for them. Okay, so this is the satisfaction we get. So we're able to give back. So that is my tagline also: restoring sight and hope. Not only losing the sight. So we have to restore their sight, and once sight regains, hope comes back. Okay, this was a person who was depressed because he was not able to read anything. He has to, go for glasses, and the glasses had their own difficulties. He has mild Parkinsonism, so he can't use glasses. Okay, so now without anything he is able to read, and his main thing is to read because he can't move out. So at home he is able to read with good lighting. So we've improved the hope for them. So that is the most satisfying thing about this field. So when sight is lost, hope is lost. So if you are going to restore sight, you are giving them hope also. So that is the best thing about this field.
In this current scenario, can you give your comment about the current job prospectus for the coming ophthalmologist and the future scope?
Okay, so job prospects will be increasing in ophthalmology. So there are very good job prospects. So one has to decide beforehand where they are going to, what kind of situation they are going to work. Whether they are going to work in an institution, whether they are going to try their hands in private practice as an individual or as a group practitioner. And third is government practice. So joining the government service and then working in a teaching institution or a hospital setup. And fourth is abroad. Okay, so all these four opportunities have their own merits and demerits, right? So this actually depends on the person. So if you are focused on research, or we want to focus on a super specialty, want to do only clinical work, I think the person has to select the institution practice. Because all the administrative management hassles are all taken care of by other people. So you are focused only on the clinical work. So you will do surgical work or medical work, then deal only with the patients. Then you have limited time for work, and then you have time for your family. So that is one way of thing. So there are other people, even in institution, they want to go up the academic ladder. They take up the teaching position in the institutions. They do a lot of research, present papers, and then publish a lot. So that is, they get the recognition and joy in seeing their paper being published and accepted as the best in the business as a peer. So there are a lot of people who have done pioneering work in ophthalmology. So there are people who have published 400 scientific papers in peer-reviewed journals for the last 20 years. They are doing exceptional work. They have been recognized for their pioneering works. They have been awarded a lot. But their focus is on their strength, okay, on academics and clinical work. Government service, if you want a proper income, monthly income, and want to establish yourself in government setup, you want pension benefits, right? So, or if you want to work only in a hospital setup, deal only with clinical work, then government hospitals will do. And again, in government hospital, there are teaching institutions. So same way here. So you focus only on the clinical work, patient care, and teach now there are a lot of medical colleges. So you can teach the students, both undergraduate, postgraduate. You can be a guide and mentor to the students. So that is teaching and clinical work. Coming to the practice, so either a private practice or group practice. So in practice, you need some other skills, right? So you have to focus not only on patient care and clinical work, you have to establish yourself as a specialist, you have to manage your reputation, you have to build your own brand, and spread that brand among the patients, among the community, among your peers. So you have to work with and develop your network. So this network development is very, very important in private practice or group practice. So the network you have decides your net worth. So unless you have this skill of networking, very, very difficult to establish as a private practitioner. So how do you develop that network? Based on your communication. So your communication with the peers, communication with the public, communication with the practice, then communication with your team, and also communicating your ideas, vision about development to your team, and then working with the associations, NGOs, social activists. So this involves a lot of other skills, other than medical skills, other than ophthalmic skills. You need some kind of time as well as passion for that. And then working as a group practice, again you have to work with the team to establish systems and practices, and the financial part you have to work on it, the accounting skills, and you have to be little knowledgeable about the business aspect, management skills also. And management is the important aspect in private practice and group practice. And then abroad. So ophthalmology has a wonderful reputation abroad.
Like, what is the opportunities in abroad
Yes.
for ophthalmologists? Yeah.
See, there are 3 or 4 areas where you have opportunities abroad. So one is the basic research, ophthalmic research. So this position is open across Europe and US. Right? Of course, West Asia, there's not much of scope for research and academics, but in US and UK, there's a lot of scope. Right? So you have to go there, work with the research assistant. You have to select the institution where you're going to work, and some of the institutions are really doing great job. And they also want Asians because we have a lot of clinical experience.
Yeah.
Okay, so they welcome. There are a lot of openings in ophthalmic research. Particularly in US, they are looking for young, bright, academic-oriented individuals. And as a ophthalmologist, clinical cadre, there is limited scope because each country has its own laws, and most of the laws obviously will benefit the local people first, opportunity to the local people. European laws, maybe it's very, very difficult to get into the clinical posting, and leave alone growing up the ladder. Okay. So you can join as a staff grade, or you can join as a research assistant in the district setups. But in primary or big institutions, to join as an associate or go as a consultant ladder, it's very difficult. The options are very limited. You have to be extraordinarily brilliant, and you also have to be a bit lucky. You have to be there at the right time. When the post opens up, you have to be there. So for that, you have to finish your FRCS, or if you're going to USMLE, you have to be cleared.
For the research aspect, they have to also have that quality examination, sir?
Yes.
For the research?
No, research, some kind of basic research you don't need. But if you're going to go for clinical research, then definitely you need a qualifying examination. And job opportunities in West Asia is wide open. The salary is good compared to Indian salaries. And they are also developing. So West Asia, UAE government is inviting a lot of people. But again, you have to be focused on the work. You have to be really good if you want to go up the ladder in UAE or any Gulf countries. But that will not be specialization. It will be just super specialization. It will be just basic like cataract and other work. But if you want to be established as the super specialty there, you have to select the institution. So there are very few multi-speciality, super specialty hospitals focusing on vitreoretina or pediatric ophthalmology. So you have to be very choosy about the institutions. So that you only if you go there and understand the work situation, you will know. So that is the scenario. There are very good job opportunities and the field is opening up. See, post-COVID, diabetes is a major problem. So there is an epidemic of diabetic retinopathy. So the good opportunity for comprehensive ophthalmologists as well as VR surgeons. Myopia is a big epidemic now. So the numbers are increasing. So there is a good patient base in pediatric ophthalmology and strabismology. Then research in ophthal is always a most wanted thing, but you have to have the interest in research. And then there are comprehensive specialties like oculoplasties with aesthetic and coming up in a big way. So that is also developing. And cornea is really doing cornea and refractive surgery because myopia is huge numbers. So there is always a patient base for refractive surgeries. And refractive surgery is one that gives that wow effect. Post-surgery, they are able to see without glasses, patients are happy, and it's a short duration surgery, but a lot of equipmentation needed. So you have to rely on biomedical engineers for that as well as investment thing. So if you are in an institution, refractive surgery is one gratifying field for ophthalmology. So there is a definite scope for ophthalmology because India has a differential pyramid. So our aging population is increasing, which means age-related eye disease will be increasing. Our pediatric population is ever increasing base. So we have myopia and related pediatric ophthalmic patients. So definitely in all across the age group, ophthalmology is bound to be benefited.
Yes, that's very good information, sir. What about the pay scale in cities and for the freshers, sir? Establishing now itself?
Yes. So you have to be very choosy in selecting the place and the hospital. As for the monetary benefits, definitely it has increased a lot compared to our time. May not be in tune with radiology or any other new fields, but definitely in the last with the advent of corporate chains and reduction in skilled manpower, so definitely the job the pay has improved a lot. Of course, medical colleges have their own limitations, so they provide only basic salary structure. But in private structure, if you are skilled enough, if you can give some more time and passion and energy into practice, it is not only a salaried structure, it is kind of sharing arrangement. So you will be incentivized if you are able to spend more time and energy. And if you are skillful, sky is the limit.
So regarding, I heard some news regarding this ophthalmology. One of my friend was discussing that ophthalmology, the current job prospectus, ophthalmology itself doesn't have any scope at present. That is, it is limited. But only thing, all the corporates now, the hospitals, they are expecting a fellowship along with ophthalmology. Then only they are recruiting. Is it like that, sir?
No, this is basically fellowship were created for the institution to develop their specialities, okay, and also some manpower who will stick to them. But actually, this kind of super specialization is not at all needed. So if you are able to learn all these things in MS, so what is MS for? Right? So the problem lies with the curriculum as well as the learning atmosphere in the medical colleges which offer MS. So if they have more patients and more resources, good teaching faculty who are already into that specialty workup, and they are able to teach the students. Okay, so now there is a problem in that. There is not enough teaching manpower who are skilled with specialized surgery. So if the teachers themselves are not skilled, how will they teach the postgraduate students? So the postgraduate students come with a lacunae.
Yeah.
To fulfill that vacuum and lacunae, they have to go to another center for fellowship learning. So ideally, if you see the curriculum at the university level, everything have to be taught in the master's degree. So the master's, as the name indicates, you have to be jack of all trades. So you have to learn everything about that particular specialty. But unfortunately, because lack of resources, including trained manpower and teaching people, and also patience. So many of the private colleges don't have patient base. And many of the government institutions don't have the resources. Like they don't have the equipment, they don't have the manpower or skilled manpower to teach the students. So this is where the problem happens. So it is not with this specialty as such. Yes, fellowship is needed if you are going to focus only on that particular specialty, super specialty. So that is an added thing. So that only in the if you want to go up the ladder immediately, you need a fellowship. Otherwise, if you are skilled enough as a MS postgraduate on various basic surgeries, definitely you'd be most wanted in any institutions, because the job opportunities in the broader specialties are much more compared to a super specialty area.
Yes, thank you, sir. And finally, one more question, sir. I think you would have crossed so many doctors, ophthalmologists in your career path. Do you feel these are the reasons for the ophthalmologists to struggle nowadays? Can you say anything like that?
Struggle is there in any field. So you know, a larva has to undergo struggle for 4 stages before it becomes a butterfly. Okay. Same way, if you are to develop as a man, so you have to go through schooling, college. Okay, this stepwise thing is acceptable. It has to be there. Otherwise, if you are given anything, you can't suddenly become a butterfly, right? You won't have the stamina. Even a planted tree doesn't become a tree overnight, right? You have to water the plant. It has to spread its root. It has to stay in one place, withstand the vagaries of the wind, climate, rain, soil, mud, all those things. Gets nutrition from the soil, and then only it can grow as a tree. The same way with people also. You can't be, gain victory overnight.
It's a part of the
it's a growing process. So one thing I see among the youngsters is they want overnight success. They feel they are entitled to all these things because they have got a certificate or degree. So it is not like that in any field, not only in medicine, not only in ophthalmology. So you have to stay put, learn the trick of the trade, and try new things, venture out. So you try new things, some of them will definitely fail. Right, so out of 10 business ideas, 8 will fail. Only 2 will give results. Even out of 2, only 1 will give big results. So even in investment, only 20% of your investment gives 80% returns. Right, all other 80% is duds. Okay, it just exists. But you can't straight away take that 20% result yielding investment. Same way in ophthalmology, one thing. So you have to have basic knowledge, develop good clinical skills. Third, practice with a mentor. So this is very important. You can't learn everything all alone. So you have to be with a mentor. You have to choose your mentor, right mentor. Be with him or her for at least 2 to 5 years. Learn the trick of the trade. Ophthalmology is not getting degree. It is getting so many other soft skills and hard skills involved. So learn from the mentor. And then after 5 years, go out and try your hand. Meanwhile, learn everything you can in a possible way. So the first 1 year to 5 years, you have to be with a teacher, you have to be with a mentor, you have to be in an institution, or whether if you like private practice, join a private practice institution. Right, you can't learn the tricks of the private practice in a medical college.
Understood, sir.
Right, that's what most of the youngsters making a wrong move. So they want to be in a medical college teaching the people. After 5 years, they want to establish a private practice. It's not possible because you haven't learned the trick of the trade. right? And same way, if you want to teach and educate, no point in spending your time in a private practice. You definitely, you have to go to a medical college or an institution where teaching is the major work. So you can't be a master of everything, and you can't get everything you want. Okay, somewhere you have to accept your shortcomings. You also have to learn your major plus factors and see where your interest is. You have to be passionate about your career. So if you want to be a career ophthalmologist in private practice, you have to be very, very passionate about your specialty, and you have to be very passionate about your clinical work, and you have to be willing to upgrade yourself. Okay, not only in terms of skill, but in terms of other aspect. Like leadership development, communication skills. If you are not good in communication, you go and attend few courses, learn the trick of the trade, and blabber in front of a crowd, right? And over a period of time, you will be a strong speaker. Okay, so nobody comes as a polished TED speaker overnight. All the TED speakers I know have failed miserably in front of the camera, in front of the mic. But now after persistent effort, they are recognized. Okay, so it takes a lot of time. So you have to be willing to wait for the results to come. So that is very important.
Thank you, sir. I think you have given a ton of information for our upcoming ophthalmologists. So it will be very useful for them. So thank you so much, sir.
Right. Thank you, Vinod. Thanks for your time, and thanks for giving me an opportunity to go through my talking back and recollecting all those things. It's not only nostalgic, but also gives us some more things to focus on, be passionate about our work. So thank you all so much.